75th year of my life, and I have been asked to speak something which is very new, and it's the most recent thinking in the medical world. That a stem cell in arthritis and the current newest trends. You see, when I was a medical student, way back in 65, 70, we read stem cells in embryology, but we never thought the stem cell will be used for the treatment also. And then in the last 50 years, everything has changed. Now we can have whole Encyclopedia Britannica in one chip. We can have everything flashed all over the world in a moment, because everything has changed, and so is the medical management of many diseases have also changed. I'm going to talk to you something which is new but old also, because a lot of people have been working on this subject for years together to reach to this point whom I'm going to talk today. First of all, I must say, what is stem cell? Stem cells are underdeveloped biological cells capable of proliferation, self-renewal, conversion to differentiated and regenerated tissues. It can grow into muscle, bone, fat, cartilage, and it can also work for the reduction of inflammation, and also it can self-replicate. The need, what is the need of talking about this particular subject? Stem cell research arose from the need to explore new therapeutic possibilities of an intractable and lethal diseases, like sickle cell anemia, the aplastic anemia and others. But although the musculoskeletal disorders are basically non-lethal, their high prevalence and relative ease of performing clinical trials have facilitated the clinical application of the stem cells in this field. Therefore, focal osteochondral defects, osteoarthritis are current targets of cartilage regeneration. To date, the literature supporting stem cell therapies comprises mostly case reports and case series. It is imperative that clinicians who adopt stem cell treatment into their practice possess a good understanding of a natural course of the disease. So, what is a stem cell and how many types of they are? There is one totipotent cells. This can develop into all types of human body, cells of the human body, also form an extra embryonic and placental cells found in early stages of embryo, but not in clinical use due to some ethical concerns. Then pluripotent cells develop into cells of all three germs, that is endo, ecto and mesoderm, represent cells of stages of embryo after the blastocyte stage. The multipotent cells develop into more than one, but not all germ layers. Adult blood cells and cord blood cell are multipotent. Now, there are two major groups of these types of stem cells. One is prenatal, that is embryonic, and postnatal, that is adult. The pluripotent blastocyte stage of embryo can form any tissue in the body, multiply in unlimited manner. Therefore, the risk of asymmetric division, tumorigenesis, and safety and ethical dilemma. Therefore, the use of prenatal embryonic stem cells guarded because of the different regions. But the postnatal multipotent, after the embryonic stage, its primary function is maintenance and repair. Mesenchymal stem cells originate from the mesoderm, good potential to develop into adipocytes, chondrocytes, myoblasts, and osteoblasts. Therefore, this type of postnatal adult stem cells can be used. But how can we get it? As well as bone marrow, the skeletal muscle adipose tissue, the placenta, umbilical cord, blood, human amniotic fluid, dental pulp, synovial tissue, skin and periosteum. All these sources we can have stem cells. Now, stem cells form bone marrow from adipose tissue, and it can go to any. This particular chart shows that stem cell therapy for osteoarthritis in India, we are trying to develop this everywhere. It can be used. And if we go, how do we use it is the isolation. How do we isolate the stem cells? This is unselected cells obtained from autologous bone marrow after centrifugation. Selected cells, the above step which enhanced in culture, utilizing their affinity to tissue plastics. Now, you can centrifuge it and get it, or you can culture it and later get it. That is, you will be talking about PRP method of treatment later on. You will look into that matter again. Now, route of administration. It may be directly applied into the lesion, either surgically or local injection with a suitable scaffold or carrier. Intravenously, it can be used. Their ability to migrate systematically and colonize the bone marrow after a peripheral injection has been utilized for treatment of osteogenesis imperfecta. The mechanism of action again, the differentiation into bone, muscle, cartilage, ligament or tendon cells, the paracrine effect whereby they secrete growth factors and cytokines such as bone morphogenic proteins, transforming growth factor, that is beta, and vascular endothelial growth factor, that VEGF. Now the key advantage of this is that the first, due to an autologous nature of these cells, autoimmune rejection risk is eliminated. Second, MSC can be isolated in relatively high quantities and with excellent purity, thus optimizing the potential or differential into target tissues in the damaged joint space. Third, like other products of regenerative medicine, MSC possesses robust anti-inflammatory properties in that they express 1L1RA and can directly antagonize resident macrophages of the joint spaces for secreting peri-inflammatory cytokines. Fourth, human MSC can be cultured and expanded via vivo using good manufacturing practices, offering an opportunity for additional pharmaceutical treatment to enhance cell proliferation, maturation, as well as their repair potential. And lastly, MSC can be utilized in human clinical trials for the past 10 years for widespread application, which demonstrates that they are safe, effective method of translational therapies. Clinical use. Now, stem cells for treating long bone defects. To facilitate regeneration of currently intractable large bone defects, stem cell therapy has emerged as a possible solution. Application of stem cells in osteonecrosis. Osteonecrosis of the death of osteocytes and subsequent structural change leading to collapse of femoral head, that is AVN we call, a secondary osteoarthritis of the hip joint. And this occurs in young. This necessitates the premature total hip replacement. We can prevent it, or longer, we can go for some time before doing the total hip replacement, a method that reduces bone regeneration with minimal surgical intervention is needed for those young patients. Now, Angavu et al. First hit on the idea of a stem cell therapy in osteonecrosis of femoral head, that is ONGAF. They added that the BMAC to cord decompression, a series of publications reported by positive results of BMAC implantation in treatment of osteonecrosis of femoral head. Several controlled studies have been published recently on the application of BMACs in treatment of osteonecrosis of femoral head, most of which reported a beneficial effect in the implantation of BMACs for culture and expanded MSCs. Stem cell for fracture healing. Now, these people have reported combined use of Elijanov external fixator with BMAC and PRP to expedite healing of bimalleolar fractures. A stem cell application for regeneration of articular cartilage and treatment of osteoarthritis. Unlike bone, which is self-regenerating tissue, the case of articular cartilage represents a dilemma in regeneration of damaged tissue. Articular cartilage has limited potential for self-regeneration, and damage to it eventually leads to development and progression of osteoarthritis. So a stem cell for osteochondral defects, while cytology for cartilage regeneration began with autologous chondrocyte implantation, ACI, the advantages of MSC are increasingly recognized. OA presents a greater pool of affected patients than osteochondral defects. Following the promising results of vivo implantation of stem cells in large animals, model of OA, a sporadic series began to be reported. Now, once we found that we're getting better results in animal models, we started using it in human beings. However, as is the case with osteochondral defect, few studies have evaluated the clinical use of a stem cell to treat osteoarthritis. Do a stem cell for knees work? This is a big question, and we are here to talk about that. A role in inhibiting catabolic activities of matrix metalloproteinase, MSC, have been shown to have a beneficial effect in OA. According to studies conducted in the Czech Republic, Korea, and United States and other centers, approximately 2,000 patients between the ages of 18 to 94 participated in these studies, and these studies, higher concentration of stem cell had a better effect. Young people in patients with stage 2 arthritis gave the best response to the treatment. After cell therapy, 67 patients showed complete healing of cartilage defect of the joint. Within 3 months, 81 to 53% patients showed 50 to 75% improvement in degenerative joint disease. After 6 months, these indicators have increased to 10 to 13%. It was confirmed by MRI, arthroscopy, and histology results. Culturing BMMSC medium rich in factors has been proven to generate the natural joint environmental components, type 2 collagen, D-chondroitin, chondroitin, adenine, cartilage oligometric matrix protein, fibromodulation, and aggregation link protein, and other proteoglycans. In addition, the compound chitogenin has been studied in mouse model which facilitate BMMSC differentiation into type 2 chondrocyte and secretion of accompanying extracellular matrix. Stem cells reduce inflammatory process and providing lasting effect in therapy. They help truly heal the damaged areas and prevent complications, inhibit catabolic activities of matrix metalloproteinase, and MSC have been shown to have a beneficial effect over. Thank you very much.